Okay, please introduce yourself.
I'm Sebastian. I'm CEO and co-founder of CareVoice, a Shanghai-based insurtech, transforming healthcare experience to be more consumer-centric.
Okay, and what's the reason for being here in Amsterdam at the DIA?
Yeah, so actually we partner with insurers to help them to become true healthcare partners of their insurance members. We bring to insurers mobile-based and data-driven solutions under a SaaS model so that they can really support their members to stay healthy, find care, and easily use their insurance benefits. We started from China, where we've been working with insurers like AXA-TianPing or Chubb. We are now starting to expand across Asia, serving mature markets like Hong Kong. But of course, in our roadmap, Europe will be next. So we're very glad to be here at the AA.
Okay, and there's a special event for you the coming days, or especially tomorrow. Can you explain something about that?
Yeah, so we take the chance to be at the AA to also announce the fact that we are launching the first artificial intelligence voice-based health assistant that is combined with our SaaS solution for insurers. That allows members to easily, from their symptoms, understanding potentially underlying cause, taking actions themselves through self-care content, avoiding useless consultation, but if they need to identify the type of providers or specialists they need to see. And nicely combined with our recommendation of medical providers solution, which is fully independent. It helps the members from symptoms to go to find care and use easily their insurance benefits.
Okay, and you're called CareVoice, so I suppose it's about a voice assistant. Can you explain something more about that?
So actually, the name of the company CareVoice is more around a strong component of how we guide people towards medical services. We have an open platform to the public where people can share their feedback about experience and get ratings and recommendations about hospitals and doctors. And so there is everything we do is like with consumers' interests first. So of course, launching now voice-based artificial intelligence virtual health assistants fits very nicely with this, because it's a lot about conversation with one-on-one with this virtual health assistant, and emotional dimension are also taken in consideration. We work with a great US tech companies that are the technology behind, and
so they provide the AI solution as well?
Yes, providing the AI solution, and a very solid medical institution behind it. They work with Texas Medical Center, Mayo Clinics. They support NHS UK with their solution. We've already a very large base of users that have been using it for triage. So we're very glad to bring this in China, because of course that's a true innovation. China is a very captive market for bringing services for insurance beyond just being a payer, and that's quite an attractive offer for end users.
Yeah, and what's the main differentiator? What problem do you really solve for, in this case, the Chinese people?
I think in China, it's one of the healthcare is one of the industries that have not yet been fully transformed. The market is still dominated by large public hospitals and basic social insurance, and people have very poor experience there. It's quite crowded. So there have been, of course, the access to specialists is difficult. So as soon as you have a virtual health assistant, you make it much simpler for many people when they don't necessarily need to go to visit a doctor to have a first support with their health issues.
Especially a doctor maybe is not close by.
Yeah, it's not close by. And it's like in China, you think about those big public hospitals are the first place to go for just a flu, just a follow-up of your kids has a small problem. People go to the hospital and they queue there. This is the mainstream because people don't have trust in the medical services. So I think, of course, that helps a lot. So parallelly, there have been lots of development of private care service in China. Now half of hospitals and clinics are private, but it's just starting to take off because people get richer and richer. They start to be willing to get better experience also for healthcare, to pay for it, and they start to be insured. So actually, we really help insurance company to support insurance members and solution like these virtual health assistants, but also to be more confident about a medical doctor or a clinic that they're going to visit if they need after this check.
Okay. You were talking about AI is an important part of the solution you offer. Can you explain something more about that? How does AI kick in? What does it exactly do? And how sophisticated is it?
Yeah. So this is a proprietary technology of Spelier, right, our US partner, and the AI component is around first NLP, right, natural language recognition. So you can have the conversation, chat, or voice conversation through this technology. It's recognized. It have very easy and natural conversation back with the virtual nurse. There is an emotional also intelligence.
So it's not really based on business rules, because that's maybe the most easiest possibility of AI, but it's more complex.
Yeah, it's more complex. There is an emotional dimension because healthcare, you need to see how the person, how anxious is a person, how urgent feel the need for response, and accordingly the avatar with who you converse adapt.
And how human is this avatar then?
Very human.
Perhaps you have seen those videos online about Google Duplex, where Google, the assistant, makes a phone call to a hairdresser to make an appointment. It really is, well, wowing people. How sophisticated is this
You'll
one?
see tomorrow on the show, show and tell. We've been selected by DIA to come here to present our overall solution to insurers, including the virtual health assistant. So it will be live and it's very real.
Okay, so we can witness that tomorrow. So, and what do you think the people will think about your solution here? Are you going to wow them?
They've been in UK. NHS Ask NHS app is powered by sensory technology behind. So in Europe, people have already and in UK have already shown very good interest in this. Very high satisfaction, over 9 out of 10, and they demonstrated evidence that through that you can avoid this useless consultation because self-care is enough. Or if you think you need emergency care, actually you can potentially delay this and just go for a normal GP visit. So that's quite efficient for people and also for the payer, ultimately generating savings.
Yeah. And now you're going to launch in China, but where do you want to be in 5 years?
So we see the company as becoming a global company. We started from China with the advantage of health insurance market, which is very nascent, where it's a wide space, so it's very good environment to innovate. There is no silos, so actually we create really a platform there that serve interest of consumers first, but also involving medical providers, insurers. We integrate with TPAs, third-party administrators that are behind the insurers for claim management and so on. So now we see that we have demand for our solution from insurers to go overseas. We had demand for Asia. We had even an offer to do a JV in Europe when we were launching just the solution in China, so it was too early for doing it. But now we are really expanding in Asia, and next will be other markets.
Okay, Sebastian, thank you very much.
Thank you.
Okay.